Welcome fourth-year pharmacy students. Man, I am absolutely thrilled to have you here for our Semester I Orientation Explainer. Look, I know many of you are probably running on a potent mix of pure adrenaline and, let's face it, way too much caffeine at this point in your clinicals. But as your instructor, I want you to realize something right out of the gate. This isn't just another class you just got to grit your teeth and get through. Drug Informatics, Phar 4241, is literally the backbone of modern pharmacy practice. You're making that massive leap from just absorbing textbook facts to actively hunting down, evaluating, and actually applying real-world data. So today, we're going to walk through the exact blueprint of our syllabus. That way you know exactly what to expect, what we expect of you, and exactly how you're going to totally conquer this module.
Okay, let's dive into this. Here is our agenda for today's Orientation Explainer. We'll kick things off with a welcome to drug informatics, then look at our core course objectives. After that, we'll map out your 13-week roadmap, break down grading and assessments, and finally, wrap up with expectations for success.
So, Section 1, Welcome to Drug Informatics, Mastering Biomedical Literature. Just as a quick level set before we really get going, this is a 3 ECTS pharmacy practice module. We're delivering it in a parallel mode, and yeah, computer literacy is an absolute hard prerequisite here. So what exactly is drug informatics anyway? Well, this module is designed to give you a really comprehensive overview of the drug information resources used across healthcare systems today. We are moving far, far beyond standard textbook learning here. You're going to learn how to systematically evaluate biomedical literature. You'll assess statistical analyses to figure out if their conclusions actually hold water. And you'll even get hands-on training at the Drug Information Center, using standard operating procedures for all sorts of computer-based resources.
81. That is the total number of required hours for this entire module. And I know that sounds like a lot, but let's break it down. Out of those 81 hours, just 20 are dedicated to actual lectures. 22 are for your home study, 8 are for tutorials, 8 for project work and presentations, and another 8 are set aside for assessments. The remaining 15 hours, well, that's your independent, unstructured reading time. It's really a highly structured, totally manageable pace, as long as you stay on top of your schedule, of course.
Moving right along to Section 2, Core Course Objectives, your toolkit.
Think of these next few points as the ultimate professional toolkit you're about to build. This brilliantly illustrates the 6 exact capabilities you're going to walk away with at the end of the term. And listen, these aren't just abstract academic goals to help you pass a test. No way. These are absolute survival skills for your clinical and community practice. You're going to learn how to rapidly locate and evaluate sources, systematically manage and communicate that info, and apply your knowledge to things like real-world formularies and clinical guidelines. You'll also learn to provide rational drug use information directly to other health professionals and, most importantly, your patients. Crucially, you'll be able to compare online versus printed resources and instantly differentiate between primary, secondary, and tertiary literature.
Which brings us to Section 3, your 13-week roadmap, the journey. Now that we've covered the why, let's shift gears and look at the what. We've grouped the syllabus schedule into a really clear, logical narrative flow. In weeks 1 through 3, we start with the fundamentals, basic definitions, the evolution of the pharmacist's role, and a deep dive into those primary, secondary, and tertiary resources. Then, in weeks 4 through 6, things get highly practical. That's when we learn the systematic approach to receiving and actually answering drug-related questions. Weeks 7 through 9 shift into some heavy critical thinking, with literature evaluation, think clinical trials and observational studies, alongside some absolutely vital ethical and legal issues. Finally, weeks 10 through 13 bring the whole shebang together. We'll tackle formulary management, drug evaluation monographs, and how to handle tricky medication misadventures like adverse drug reactions.
Let's zoom in and see how this builds, specifically looking at those crucial weeks 4 to 6. You're going to learn a modified, systematic approach to fielding really complex drug questions, and it happens in 5 steps. Step 1, you start by getting the requester demographics and background questions. Step 2, you define the ultimate question and formulate your search strategy. Step 3 is all about evaluating and synthesizing the data you dig up. Step 4 is actually formulating and providing your response. And finally, Step 5, which honestly is often the most important part, is your follow-up, follow-through, and documentation.
By week 8, we hit the high-stakes reality of everyday pharmacy practice. I mean, how do you navigate ethical dilemmas, complex labeling, and liability concerns? We're going to dive headfirst into the basics of ethics analysis, intellectual property rights, and the very real liability concerns that pop up when you're dealing with internet information. It's fascinating, it's incredibly complex, and it is absolutely vital for protecting both yourself and your patients.
To navigate all this complexity, you're obviously going to need the right resources. Your required textbook for the course is Malone's Drug Information, A Guide for Pharmacists, specifically the 6th edition from 2018. We also highly recommend exploring the American Hospital Formulary Service database, Drug Facts and Comparison, and Text by Slaughter and the World Health Organization. Seriously, these are going to be your absolute essential guides for our professional writing assignments, so definitely keep them handy.
All right, let's move into Section 4, Grading and Assessments. No surprises. We operate with total transparency here, so let's ease any of that first-day anxiety by breaking down the balance of your grade. Notice that your final exam is 30%, and tests and quizzes are 20%, but listen to the rest of this. Assignments and presentations make up 30%, and evaluations of your on-site practice performance make up 20%. What that means is a full 50% of your grade is based on continuous hands-on learning. Things like monograph development, critical appraisals, and responding to real drug information requests. We really want to reward consistent practical effort over sheer rote memorization.
Finally, Section 5, Expectations for Success, a dual responsibility. Now, this isn't just a laundry list of what I expect from you. It's really about the professional dynamic we're going to cultivate together in this course. You'll notice there's a real shared responsibility here. My role as your instructor is to act as a facilitator. I'm here to introduce the subjects, supervise your actual practice in clinical and community settings, assist you with those tricky ethical dilemmas, and strive to be an ethical role model for you. On the flip side, your role as fourth-year students is to engage as active learners. You're expected to dive into independent study, critically assess laws and journal articles, and actively participate in group assignments and seminars. It's absolutely a two-way street of professional respect. So, the absolutely crucial point is captured beautifully in this quote right out of your syllabus. Make every effort to apply valid research findings and theoretical teachings into practice in various practice settings. That right there, that is our ultimate goal. We are taking the theory you learn in the virtual classroom and transforming it into real, life-saving practice in the real world. Which leaves me with one final, pretty important question for you before we wrap up this orientation explainer. Are you ready to become the ultimate medication information provider? Look, this course is absolutely going to challenge you, but it's also going to equip you with the very skills that make pharmacists such indispensable and heavily relied upon members of the healthcare team. So grab your syllabus, secure that textbook, and prepare to dive headfirst into week 1. I'll see you in class.